One of the greatest achievements that I believe we accomplished during this recent General Assembly session was the passage of House Bill 5499, which is an act regarding the regulations for hospice facilities here in the state of Connecticut. It is a piece of legislation that I've been actively involved with to its proposal stage, and it really was born by the regulation changes that the Department of Public Health brought forward about 18 months ago. In effect, the current regulations, which were established in 1977, were intended for the department to have specific regulations to have oversight of any inpatient hospice care facilities in the state of Connecticut. When they were first developed, the only inpatient hospice care facility in the state of Connecticut was the current Connecticut Hospice located in Branford. Much has evolved since then, including the ongoing demand and need for such a facility for patients throughout the state of Connecticut. In addition to that, many medical and technological advancements have also changed the national model for which these facilities are established. And it was recognized by the department, who has the oversight, that it was time that Connecticut brought forward regulatory changes that would be more appropriate for current day needs and use. Initially, it met with great opposition, coming most from the current hospice facility in Branford. But I would say that overall, there were many areas of Connecticut and many of my legislative colleagues who come from those areas who realized that now that hospitals who previously had collaborated with regional hospice organizations to provide palliative care to those patients in the most need and to their families who were going through that traumatic and challenging time with them, that we needed to have the opportunity to expand those kinds of facilities here in the state, not only logistically and for a convenience factor, but the truth is, as we heard in the public hearing process, that oftentimes the Connecticut Hospice facility, which has 52 beds, was beyond its capacity and could not accept any additional patients who were in their time of need. We only have one other facility currently, which is within St. Mary's Hospital in Waterbury, that has 12 beds that are committed to that purpose and run by an out-of-state organization. We are fortunate to have the Regional Hospice of Western Connecticut located in Danbury, Connecticut, as well as one in New London in southeastern Connecticut, that have plans to build state-of-the-art 12-bed facilities for this very purpose. This piece of legislation will not only allow for that to occur, it will help to expedite the process. The Danbury facility, for instance, will break ground in September of this year, now that this legislation has passed, and build a state-of-the-art 12-bed facility in Western Connecticut to serve the people in about a 12-town radius, perhaps even further. There was a facility, for instance, in Stamford that was shut down in recent years. We're hoping that these other two facilities will spur the interest and the ability for others to crop up throughout other parts of the state, so that the patients that are in need of palliative care will have an appropriate place for that to occur. For those that are less familiar with hospice care, it really is not what some might view as only for cancer patients in the last days of their life. It really is a method and form of care for many chronically ill, terminally ill patients who may have other health-related issues. And it's intended to provide the most home-like environment for those patients to spend their final days with reasonable medical care not to cure them, but to provide them with the highest level of comfort and therapy that will make those final days as pleasant and as supportive as possible. These facilities will be staffed by physicians, by nurses, by volunteers, and other medical professionals. They will have 24/7 pharmaceutical access. They'll be in private rooms that are suites, where there'll be living areas where their families can spend those final days and hours with that loved one in a level of privacy, but also in an area and environment that provides tranquility and peace and comfort. I can't think of anything that we've done in this recent session that is more important than that. I'm very proud to be a longtime member of the Regional Board of Directors of Danbury's Regional Hospice in Western Connecticut, and I'm looking forward to continuing to work with them and all of those who support them to make this dream become a reality. I'd also like to thank the many colleagues of mine, and I think the number exceeds 60, who were co-sponsors of this legislation, which passed unanimously in the House of Representatives and with very strong, nearly unanimous support in the Senate. Thank you.